Good afternoon, everyone. This would be my visual speech, visual aid speech, and I will be speaking on when should you see a vascular surgeon. I had a PowerPoint, but it's not working right now, so I'm going to just allow everyone to view the PowerPoint I have given, and we'll slowly go through this together. When should you see a vascular surgeon? A vascular surgeon is a physician that is highly trained and specialized to treat disorders of the circulatory system, arteries and veins, and vital organs that filter the blood throughout our body systems. Vascular surgeons help patients to maintain and manage conditions that affect the blood vessels. They also help patients to control diet, medication, and interventional procedures that they may need due to circulatory problems. Vascular surgeons are trained to perform minimal invasive procedures such as angioplasties, stenting, and specialized traditional surgeries. When should you see a vascular surgeon? If you've ever been diagnosed with an aneurysm or have any symptoms or concerns, you have issues with varicose veins, you are concerned with circulatory problems, or you've been diagnosed with atherosclerosis of the carotid arteries. What is an aneurysm? An aneurysm is pretty much an enlargement of an artery, normally an artery, and it can occur anywhere in the chest, the abdomen, or lower extremities. An aneurysm can be diagnosed through an ultrasound, CT scan, or an MRI. You run into problems with aneurysms when the blood vessel begins to enlarge and the walls begin to thin within that artery, and you run into chances of that artery rupturing. If the blood vessel where the aneurysm is up in the abdomen area, it's considered an abdominal aortic aneurysm, also known as a AAA. A vascular surgeon can tell you when an aneurysm needs to be repaired once it is diagnosed, and this is normally based off size. Sometimes it needs to just be watched, other times it needs immediate assistance, surgery, repairs, interventional procedures, such as most surgeries or procedures are done by those vascular surgeons that are board certified. Other conditions that vascular surgeons can treat are varicose veins. Most of them are in the legs. You see people walking around with those big ropey veins. Looks like a snake that is running through their veins, treacherous, going through the skin. It causes swelling, a lot of discomfort, and that is due to basically faulty or leaky valves that need to be repaired. Sometimes those leaky valves or just pain or other complications can cause blood clots, which need to be treated with surgery and sometimes medication, blood thinners. Varicose veins, these are the type of vein problems that can cause similar leg problems. A vascular surgeon can fully evaluate your leg for veins and develop the right treatment plan for you. Some of the diseases that causes circulatory problems includes PAD, peripheral arterial disease, which occurs when atherosclerosis or hardening of the artery causes a buildup of plaque in the blood vessels that carries oxygen and nutrients to the tissues of the body. PAD also can cause pain, swelling, severe foot ulcers, infections, and even gangrene. A lot of the times with diabetics, PAD can cause them to lose their leg if they're having issues with the healing of painful and non-healing wounds. Circulatory problems are sometimes very difficult to diagnose and are sometimes misdiagnosed due to other issues and physical problems. The risk factors for developing PAD are similar to those for patients that suffer with cardiovascular disease. Cigarette smoking puts you at higher risk. Diabetics are at higher risk. People that suffer with high blood pressure are at increased risk, along with high cholesterol. Arteriosclerosis of the carotid artery. The carotid arteries are the arteries that run down each side of your neck. And these arteries are responsible for delivering oxygen-rich blood from the heart to other parts of the body. Carotid arteries can also have a buildup of plaque. Plaque narrows the passageway within the arteries and causes them to become stiff. If at any point narrowing or blockage occurs, there's chance of CV or stroke. Sometimes if the narrowing is low, the percentages are low, through viewing through ultrasound, these conditions are monitored over time. So anytime you're meeting with your primary care doctor and you have any of these issues or concerns, varicose veins, AAA carotid artery disease, PAD, they can refer you over to your local vascular physician's office, or you may contact your own local physician office if you have any concerns, symptoms, or problems that you need addressed. Thank you for your time.